Hi everyone, this is Dr. Hammer, Counseling Psych Professor at University of Kentucky, and I'm recording this video today because I just read an interesting article in the Training in Education and Professional Psychology journal, which a bunch of directors of counseling psych and clinical psych programs like to keep tabs on because it's all about education and training and psychology. And the title of the study is Faculty Evaluations of Student Applicants Who Disclose Mental Health Information in Empirical Examination. This is by Dr. Amanda Zold and colleagues. And I thought this study was really cool because it's a very practical look at questions that people often have when they're thinking about what to write in their personal statements, especially for a lot of us who've dealt with mental health concerns in the past. And so we might wonder, this maybe has been an important part of my experience. Should I speak to this when I write my personal statement? Is this some part of my experience that I should feel comfortable sharing in my application? And you might say, well, it's a genuine part of my experience, but on the other hand, I worry someone might stigmatize me for it or think I'm less qualified for graduate school. And so they actually collected some data on this question, which I thought was really cool. So I downloaded the article through my institution, and I've been looking over the results. And so before I summarize the results, I want to talk about who is in the sample. So who was it that rated this hypothetical applicant that was used to measure attitudes among faculty and stuff like that? So faculty participants were recruited from APA-accredited clinical psych or counseling psych doctoral programs. So that means PsyDs and PhDs, counseling psych or clinical psych. The final sample faculty participants was 184, average of 45 years old, primarily 56% is female, 91% Caucasian. Overall, the characteristics of the sample were representative of APA psychology faculty members in general. 35% of faculty had reported they had received a mental health diagnosis themselves, with depression being the most commonly reported diagnosis. A variety of faculty types, so about 28% were assistant professor, 37% associate professor, 33% full professor, and all were currently involved in evaluating student applications for the graduate program. So these are exactly the type of people that if you're applying to a clinical psych or counseling psych PhD or PsyD program, whether it's a scientist practitioner model or a scientist practitioner advocate model or a clinical scientist model and PhD or PsyD, they had folks of all those types in here, and they're the folks who are evaluating applications, the type of applications you may be submitting. The majority were core faculty for programs that identified as clinical. So 80% of the people in the sample were from clinical psych programs, 17% from counseling psych, and 2% from combined programs. 76% were from PhD programs, and 23% were from PsyD programs, 60% from scientist practitioner, which have both science and practice as a focus. About 20% were scholar practitioner, which tend to be PsyD programs, mostly focused on practice. And then clinical scientist, about 17% of the sample. And that's focused more heavily on research with some clinical training. And you tend to see that only in clinical psych, those clinical scientist programs. Faculty reported that their programs received a mean of 175 applications per year and accepted a mean of 14 students every year. So that's what you need to know about the sample. So you can think about how the following results may or may not apply. And thankfully, they did some subgroup analyses so that we can get a sense of who was seeing this, who was kind of looking at it this way versus that way. So let me get to the good stuff here. So the discussion, I'm going to read some key pieces from the discussion. Many popular resources discourage student applicants from disclosing any kind of mental health history when applying to graduate programs in professional psychology. However, empirical research testing the impact of such disclosures is limited. So to their knowledge, this is the first study to test whether a fictional applicant would be rated more negatively by faculty in APA-accredited professional psychology doctoral programs if they disclosed a history of depression and or that they attended psychotherapy in their application material. So did they mention that they had a history of depression or that they attended psychotherapy? And so it was a 2x2 design where there was 4 conditions. And so they said they either mentioned depression history or didn't, or mentioned seeking psychotherapy or not. And so you could have 4 different combinations of that. So they could see the impact of these 2 independent variables, the disclosure of depression and the disclosure that this applicant had sought help, to see what impact that might have. And previous research has indicated that mental health professionals do worry that employers and colleagues may pass over them if they disclosed a mental health history, and findings from this study support those professionals' concerns in academia in the case of graduate school applications. So these concerns may stem from the role that faculty members fulfill as gatekeepers to the profession. They may screen out applicants with a history of depression due to concerns that they will not perform well in the profession, worries about the applicant's ability to display personal and professional boundaries, or concerns about the applicant's ability to succeed in graduate school. So those can be some of the reasons why faculty may be hesitant about an applicant who mentions a history of depression or a history of psychotherapy. And this is not, and they did not test, like, what if you mention anxiety or an eating disorder or something like that. They chose depression because it's one of the most common types of mental health disorders that someone may talk about in an application. Previous research also suggests that individuals with a mental health history may be overlooked because they are deemed unfit to provide psychological services, et cetera, et cetera. The majority of faculty, so here are the results as captured by the discussion. The majority of faculty in the sample of 180-ish recommended against any form of mental health disclosure in application materials, a finding that's consistent with previous survey research as well as recommendations that are made in the literature. Regardless of the hypothetical applicant, when they asked these 180 professors, do you think applicants can disclose history of depression or seeking help, the majority of faculty recommended against any form of disclosure along those lines. It goes on to say, when testing predictors of faculty evaluations and opinions about mental health disclosures, program type was repeatedly identified as significant. Specifically, faculty and clinical scientist programs, compared to the other types, rated the applicant lower in all areas, how acceptable they were, how suitable they would be for the program, the perceived likelihood to succeed in the doctoral program. These are all metrics upon which they rated this hypothetical applicant. So faculty and clinical scientist programs rated the applicant lower in these areas when a depression history and or psychotherapy use history was disclosed in the application materials. So for those of y'all applying to clinical scientist programs, this data would suggest you don't want to mention that stuff if that's been a part of your experience, because it will lead you to be rated lower, probably. A difference between the types of programs was not observed in the no disclosure condition. What else? The results from the logistical regression analyses suggest that faculty from counseling psych programs compared to clinical programs are more comfortable recommending that applicants disclose their mental health histories in their application materials. So there was more openness to this disclosure among counseling psych programs compared to clinical psych programs. And also there was more comfort from faculty who were from PsyD scholar practitioner programs, whether counseling or clinical, to more open to applicants disclosing their mental health histories in the application materials. So scholar practitioner PsyD programs, that was more acceptable in the eyes of the faculty. What else? So I'm going to scroll back up to the abstract here. So although faculty, so this is for the whole sample, okay? Although faculty did rate the applicant, this fictional applicant, as equally suitable and likely to succeed in graduate school, faculty were less likely to recommend accepting the applicant when a history of depression was disclosed. So overall for the entire sample, so keep in mind the demographics, and the numerical majority of the sample is driving this effect, right? But it says that faculty were less likely to recommend accepting the applicant when that applicant mentioned that they had a history of depression in their personal statement. However, faculty evaluations did not differ based on disclosure of psychotherapy use. So in general, overall, for the average counseling psych or clinical psych PhD or PsyD program, when you lump them all together, mentioning that you sought psychotherapy or not does not impact on average. The majority of faculty recommended against disclosing mental health information in application materials, but faculty from counseling programs and scholar practitioner programs were more open to disclosure. So yeah, so that's something that you, those are like the key overall results, and some of the stuff I said earlier about the breakdown around specific types of programs and how people were rated. So what does this all mean? If you are applying to clinical psych programs and especially clinical scientist programs, I would not mention depression or anxiety. I would not mention history of depression or history of seeking psychotherapy. If you're applying to counseling psych programs or to PsyD, scholar practitioner programs of any specialty, you're probably safer in mentioning that. And particularly, it seems safer to mention a history of seeking psychotherapy as a person rather than disclosing the particular mental health concern you may have been dealing with, particularly if that concern was depression. So I thought this was a really, really cool article. I'll provide a link to the article, to the citation for it in the description for this video, but it's really nice to have some substantive data on this question of the pros and cons of mentioning personal mental health history in the personal statement. So I hope that was interesting, and thanks for watching the video, and please check out my other videos and all the advice on getting into graduate school and exploring psychology careers that's on my website, drjosephhammer.com. So thanks a lot. Bye.